Okay.
Hi, everyone. This is Katie. Thanks for joining us today. We're still a little bit early, so we're going to give it a few more minutes. But thank you for being here, and we have a great presentation today. A few more minutes. Hi, everyone. This is Katie. Welcome to today's call. We just have a few more minutes before we get started. So if you guys, we have the presentation up on the screen. So if you can make sure that you could see the PowerPoint presentation. And if you have any questions, there's a chat box. So go ahead and send us any questions that you have. And then we'll get started in a few minutes. Hi, everyone. Thanks for joining. We have a great presentation today. We're going to get started in just a few minutes. We're going to let a few more people hop on the call, and we'll get ready to go. Hi, everyone. Just a few more minutes. Just some housekeeping. Everyone is entering on mute just to help control the sound. There is a chat box on the toolbar. So if you'd like to send a question, please use the toolbar, ask us questions. We do want to make this interactive and a learning between both parties. And so if you have a question, please put it in the chat box, and then we'll have pauses throughout the presentation where we can ask questions. The presentation will be available after. We are going to have it up on our website that is coming very soon. So this will be a resource that will be shared with you. So don't worry so much of taking notes on every piece of the list. It's quite extensive what Sarah Kolo has put together for us today. And this will again be available after the presentation, as well as the recorded webinar that you can share with your teams. Great, so let's wait 2 more minutes just to have a few more people jump on the call. And then I will introduce Sarah. All right, everyone, so let's go ahead and get started. My name is Katie Conklin, and I'm with the California Oral Health Technical Assistance Center here at UCSF, and we're really excited to be presenting materials that you can use with your local oral health programs and really go into how the National Maternal and Child Oral Health Resource Center can be a tool for you and your teams on finding evidence-based and best practice resources that can translate into community projects that you guys are doing. So I'd like to go ahead and turn this over to Sarah Kolo. She has a great presentation for you today. And just as a reminder, this will be available later and also the recorded version. So with that, Sarah, if you want to go ahead and get started, thank you.
All right, thanks, Katie. It's great to be here today. Thank you, everybody, for attending today and giving me a chance to talk to you about our center. Today, I'm just going to be sharing lots of great resources with you, but I'm also going to teach you how to find the things that are most relevant to your needs. I'll begin with an overview of our project and give a tour of our website and take your questions. And I will try to stop talking from time to time, as Katie mentioned, so she can feed me questions that you've put into the chat box. We want to keep this lively and meaningful for you. And I'll finish up with contact information. I'm sure I will not be able to address everything to your complete satisfaction today, but I am available to you via email or phone anytime after this discussion. So I'm also got a cold, so I'd like to apologize for any interruptions. And I think I want to adjust my screen share so that I get off my presenter view. Let me see what I can do about that. Pardon me for 1 second. How can I fix this? So Katie, if you can come off mute and tell me, let's see here.
There, we can see a black screen.
Okay, give me 1 second here and then tell me if it's the notes or slide.
Perfect. Yeah, we can see your slide.
Okay, that's better because nobody wants to look at all my dumb notes. All right, so I'm Sarah Kolo. I'm a health communication specialist and I've been here at the center for a long time. I'm not an oral health professional. I came up working on several maternal and child health projects as a project assistant, and over the years I've ended up wearing many hats here at OHRC. I work on outreach projects like the website and email lists and other communication tools, report writing, some evaluation, and provide information assistance. And that's the favorite part of my job, is interacting with professionals like you out in the field. I work from home and I spend a lot of my day just on email with people around the country. So I really invite you to reach out to me. Our project is housed at Georgetown University in Washington, D.C. So our center is the Center for Oral Health System Integration and Improvement, and we call it COHSII with the acronym. The center works with key stakeholders to improve existing systems of care by using a quality improvement patient-centered approach. And we address the oral health needs of the maternal and child health population, which, as you know, are pregnant women, infants, children, and adolescents, and all of those with special healthcare needs and their families. Our project is a consortium that is led by the National Maternal and Child Oral Health Resource Center, or as we call it, OHRC, at Georgetown University, and we work in partnership with the Association of State and Territorial Dental Directors and the Dental Quality Alliance. We are supported by a 4-year cooperative agreement from the Federal Maternal and Child Health Bureau and the Health Services and Administration, Health Resources and Services Administration. And we are in year 2 of this 4-year project period. So a little bit of what we do on COHSII. I'm having trouble advancing my slides for some reason. Here we go. Did that switch to the view again, Katie?
Yes, it looks good.
Okay. So we have 3 goals under COHSII, and I just wanted to touch on them so you get an idea of the big picture of what we do. The first one is about providing technical assistance and training, mainly to the state Title V block grant programs, but then also those that they work with, and the special projects of regional and national significance, or the SPRANS projects from the federal MCHB. That means that we're supposed to support the activities of the MCHB funded oral health projects across the country. The second goal is about defining a set of maternal and child oral health quality indicators to monitor services delivered in public health programs and systems of care. And the third is about developing and disseminating oral health educational resources. So you can see why that's a great fit for our presentation today. So like I mentioned, COHSII is just one project under the National Maternal and Child Oral Health Resource Center, and everything we do is on our website for you to access, use, and share. As a matter of fact, we have quite a few different projects represented on our site, but I'm guessing it doesn't really matter to you which project does what. The important thing is to know what you can find here and how you can use it, and to get in touch with me if you have any questions about those details. But first, you need to know where to find us. So here's a quick look at our URL. It's just mchoralhealth.org. Back to our homepage, I just want to give you a quick tour around the parts of the homepage, and then we'll dive deep into some other resources. Any questions so far? I can't imagine there's anything yet. Okay. So on the left, of course, there's a navigation bar with several items that we can look into in a little bit. The middle section shows features that we want to have about news and announcements. In fact, that top one that I've just obscured with that lovely arrow there is about an upcoming announcement, funding opportunity announcement that just before this call came out. So that's already, our website has already been updated from this screenshot that I took just last week. So that's the main area in the center, is where to watch for news. This section over here is the featured resources graphics. These allow you to find some of our flagship resources without having to click too far deep into the website. I think it is worth clicking into each one of these to show you briefly a bit about each one. I think that you're going to find them very useful. Something to ask yourself as you begin to use our site is, who is the intended audience? We have materials for oral health professionals, non-oral health professionals, educators, payers, and the general public as patients or consumers of healthcare, as well as family members. We pondered whether to set up the site with a gateway to choose that audience, but the fact is that most of our audience needs both. You may work in a local health department and you are the bridge to different healthcare professionals and community partners, funders, and families. So consider which audience you're trying to educate when you begin your search, and you'll be more successful. So now we're gonna, I chose to do this web presentation as a slide deck instead of a live site because frankly, when I demonstrate live on the site, either the internet connection goes down or I scroll around so much and I make people dizzy. So this is sort of a mimicked website just to control for some unforeseen factors. So it's going to be a little bit different than scrolling, but hopefully less nauseous. The first thing I'd like to look at is the Bright Futures Pocket Guide. This is a product that I think is going to be especially helpful to many of you since you may be helping to make the connection in your community between oral health and overall health. I'm sure many of you have heard of the Bright Futures Health Supervision Guidelines, which are federally funded and have been produced for years by the American Academy of Pediatrics. This is the oral health topic guide for Bright Futures, and that it is written for the non-oral health professional audience. So that means pediatricians and family physicians and other community-based health providers who just need to know how to talk to families about oral health. It's arranged by developmental stage. You can see there on the left, the oral health supervision. Under that is pregnancy, postpartum, infancy, early childhood, middle childhood, and adolescence, in order to deliver content that aligns with the periodicity schedule of well baby and well child exams. So if you click on one of those stages, for instance, early childhood, you'll see that as you scroll down, each developmental stage contains the components of the well child visit, like family preparation, and then further down, interview questions, information about risk assessment, screening and examination, and then anticipatory guidance on all sorts of different topics like that are related to oral health. For instance, nutrition and injury prevention and hygiene. And then it wraps up with the outcomes, the expected outcomes from that visit. The guide was originally produced in print as a pocket guide that would fit in a lab pocket, but you can print the whole thing. We don't have print copies available any longer. So also on this little mini site, we offer options about printing. You can print a page right from the browser, of course, but we've also laid it out in a PDF file that's printer friendly with 2 pocket guide pages per full sheet. So it doesn't take quite as much paper and it's more efficient. But truthfully, the best way to do it is to download the PDF and put it on your device, your phone or your iPad or other reader, and enter it into your reading app like iBooks. And then it just flips through beautifully and you take it with you wherever you go. So I wanted to spend a little more time on this particular resource because I think it's got a lot of the right tools for you and your audiences. But I think I should take a break and ask for any questions.
Yeah, thank you, Sarah. Let us go to the chat box and see if we have any questions from the group. Yeah, we don't have any questions at this time. So if you want to keep going, and then we'll take another break.
That gives me a chance to take a sip of tea and get back on. Okay, so back at our homepage, the next item on the list there is the consensus statement. And by this, we mean the oral health care during pregnancy, a national consensus statement that was developed in 2011 and published in 2012. You can link right here to the consensus statement and read all of the different aspects of that guidance. And there are different resources also related to that on this page, like these periodic updates that we do that are almost like newsletters on how different people across the country are putting the consensus statement into practice. So those are great examples on how to translate that guidance into practice. And then the consensus statement is also divided into different sections, like for oral health professionals and for primary care professionals, and for prenatal care professionals. So further down this page, we offer separate PDFs of each type of professional, each component of the consensus statement. So you can print the one that you want and make copies of that instead of having to print the whole thing. Another component of the consensus statement is a tip sheet for pregnant women. And I'll show you, that's further down this page, but I'll show you another place to find that too. So that's a gold mine on one little page there. The next one is the integration framework. This is a product that came out of working with another batch of federally funded oral health projects called the School-Based Comprehensive Oral Health Services grants. And out of that grant project and the lessons learned, we put together this manual of how to integrate primary care into school-based healthcare, integrate oral health into that primary care services. So it's a little bit of a fringe, but if that's what you're working with, that's a really super tool to be able to consult, and that's linked from our homepage. This next page, the next item, consumer materials, I think is another big item for you guys. This page does list in one convenient spot all of our materials for families. So I am going to kind of fake scroll down to show you more about this, but the top section is our standard series of oral health tips for pregnancy, infancy, and early childhood. And you can see they're here in English and Spanish, and one title is in German, which is kind of interesting. And lately, we used to do a lot of printing and shipping, and we are not funded any longer to do that. So we're trying to pay careful attention to how we format resources to make it more efficient in time and money to make your own copies. So these were originally trifold brochures, and you can download them that way. But we also laid them out in an 8.5 by 11 full page layout, and without a full bleed, so you don't have to stay after work and fold things into threes, fold up brochures. So you can find all those there. Excuse me. The next thing down the page is this series called Healthy Habits for Happy Smiles. This is a series in English and Spanish, and the reason I love this is that it's super family friendly. The pictures are large, the type is large, but there's a lot of white space. And more importantly, it focuses on just one aspect of oral health or guidance so that you don't overwhelm families during a visit. So if you have home visitors or Head Start, WIC, it's a really nice collection to have available, and then you print the topic that you'd like to focus on that day. These are in English and in Spanish. And here's an example of brushing your child's teeth. So this is just each one of them is just a double-sided one page. So you can see it's really photo forward, simple messages, a few bullet points, great pictures. And this was produced in our project with Head Start, but it's also in the public domain, and you can make as many copies as you'd like. Okay, now further down that consumer materials page, we get to another place where that tip sheet from the consensus statement is listed. So this is tips for good oral health during pregnancy. This one is available in English and Spanish and all these other languages here. And again, it's just one page, double-sided. I'll give you a peek at the Spanish version here. Again, clear points with researched information. You can trust this content. You can share it. And print as many copies as you need. The next item I wanted to look at is the Seal America manual. You may be familiar with this. It's been around since the 90s. It's in its 3rd edition. This is an online sort of cookbook on how to start a school-based dental sealant program. And it doesn't convey any continuing education credits, but it does show steps that you can just pick and choose from to focus on any aspect of the program, whether it's gaining community support or selecting supplies and equipment, even the workflow of the students moving through the program in the school. It finishes up with a terrific video that's just about 2 minutes long, I think, and excellent for recruitment. If you're having somebody doing parent meetings to collect consent forms, or if you're working with superintendents or other school personnel to get the program in the school, it's a really nice promotional video that explains the purpose of sealants and the process for applying them. Excuse me. This video is on this page. It's also on YouTube, and it can be downloaded for local use. And we present this in partnership with our friends at the Ohio Department of Health, who originally produced it in the 90s and just in 2016 did an updated version. So it's nice to have a fresh look on that. A related resource is this school-based dental sealant program curriculum. This is a whole series of online modules for self-study. And again, it goes through the aspects of the school-based dental sealant program. This does provide continuing education credit, but unfortunately only to professionals licensed in Ohio. However, even if you're not licensed in Ohio, we will provide a completion certificate. And we have had experience where programs will use this curriculum and the completion certificate as staff training, perhaps onboarding new staff, or when they start a program, getting everybody on the same page. So I think you'll find that this might be a useful reference or resource even if you don't get continuing education credits for online training. And the next one is another online curriculum called Special Care, an Oral Health Professional's Guide to Serving Children with Special Healthcare Needs. This is in its second edition, and this does provide continuing education credits for free. I know Katie mentioned to me that some of you were interested in how to engage local oral health providers. And this might be a terrific way to alert them to some free training for free continuing education credits. And they can do self-study and learn more about how to care for this vulnerable population. And that's a win-win. You tip them off to some free training and they perhaps will start seeing more kids in your community. So this is 5 modules of how to, like, special tips and tricks on addressing that vulnerable population. This next item is sort of an archive of a conference we hosted a couple years ago that was funded by the Robert Wood Johnson Foundation about oral health and obesity and the role that oral health providers can play in engaging families in paying attention to the obesity epidemic. So on this site, you can find the conference faculty and authors, papers and presentations, and it's just a way to capture that activity. And finally, we look at the Safety Net Dental Clinic Manual. This was produced in partnership with the DentaQuest Institute when it was the DentaQuest Institute, and the Safety Net Solutions. Mark Doherty there helped us update this massive manual. This is not credit bearing, but it's an online manual that's about 500 pages long if you try to print it. It's a soup to nuts examination of what happens at the Safety Net Dental Clinic level. And it does go through all these different sectors of finances and facilities and quality and clinical operations. And the other terrific tool that's here is a site index. And I'm going to give you a glimpse at that. And you can page through every section of every unit and click right where you need to go. So, or you can use the search tool. And there's a wealth of information here. It is possible to download this site and print it as a PDF file, but do exercise caution because of the length. All right, so that quick review is really the things that we find that people use the most. And I just want to reiterate that those are easy to find from our homepage. I don't see the chat box bubbling up. Katie, do you see anything?
Not yet, but I do want to ask a question the group may have. We've been receiving a lot of questions on you mentioned public domain. And where is the line of how the local health jurisdictions can use these materials to support like their programs that they're doing? So if they were to find like a brochure on a topic and they download Could they put their logo on it, or what are your recommendations for using the materials locally?
Right. Okay. Well, most of these things, all the things that we produce that are on our website, you can feel free to disseminate as much as you need to. You can make copies, you can print copies. If you go to a copy shop and they need to see proof that it's not a copyright infringement, there is a statement at the bottom of each one of our materials that allows for copying. So you can have confidence when you present that to someone else that you'll be allowed to finish the job. Generally, I understand that, on a brochure or something, you might want to put your own logo on or a sticker with your address to personalize it. If you don't obscure the information, that's fine. If there's any impact at all on the layout of the content, if you want to electronically add your logo, or if you want to excerpt some information into a different product, we just ask that you write to us and ask for permission. We hardly ever say no. It's more of a dialogue, and we'll work with you on how to make sure it doesn't affect the content of the resource and how to cite attribution and give credit back to us. And we'll also be collecting those requests as a way to show our funder that our resources are useful in the community. So it's a win-win for us that we know how this can be impactful in your work, and you know how to use it carefully. But straight up printing and copying is always allowed, and any kind of adaptation or reuse, we ask that you contact us for permission.
Great. And then we did have a question on the special care curriculum, if it's only for Ohio providers.
Oh, good question. No, the Ohio distinction is only with that school-based dental sealant program curriculum. Special care is up in a partnership with the American Dental Hygienists Association and the Indian Health Service, and credits are available to dentists, dental assistants, dental hygienists, and anybody across the nation can use it. There's no charge. The certificate is processed once a month and sent via email. And we also have relationships with several universities and residency programs whose professors are assigning students in their classes to take the curriculum. So that's another way to use that certificate. So yes, that is open to all and free.
That's wonderful. I know that's a big question people have, or, how do you engage the dental professionals? How do you get them to come to your advisory committees, participate in the program? And CEs and food are always those top attractions.
Right. Well, we hope that you can use these, definitely. And it's nice, it's not just dental hygienists or just dentists. The whole professional spectrum can use these and get credit.
Great, thank you. Yeah, we'll wait for some more questions as we're continuing.
Good, okay. Now I'd just like to go down this left navigation bar. I know this is a little slow. It's hard to watch somebody else use a website, but it's all about teaching you how to find things. On the left nav bar, any of those orange items, once you click on them, expand into sub-items. So you can see under the COHSII item that we can show you an about, and then the different aspects of the COHSII project. So this is just a snapshot of the about page that you can learn more about the different things that we do that I talked about at the top of the webinar. For instance, the quality indicators goal, on that page you'll find the members of our team that are helping us advise our advisory team on this goal, and also the work of the team so far. There's a report about how we determined the set of indicators, and a handout that's a summary of the indicators, the background environmental scan, and a project summary about the pilot that's currently in use. So even when it's not resources for families or things like that, there's a lot more information on our website about our program. The next item is our library. The things I've talked about so far today are all things that we've produced or produced with others. We also have a library where we collect things that you produce. We have a library of about 3,000 materials, and it's not the professional literature from journals, it's local program manuals or state health reports or manuals or brochures or consent forms. It's a rich resource of things that are contributed by you and can be used by you instead of starting from scratch when you need perhaps maybe a fluoride varnish program guide. You can search our library and maybe you can adapt that product instead of starting fresh. So the way I'd recommend using the library is just doing a search the way you would in any library. You can either click on the materials item there, or you can see a search box on the lower right of our website homepage that you can search either the library or our website. But for instance, if you just click into materials, you'll come to a search box, and right below that you can even select an advanced search and search by author or title or keyword. You could put California in, or you could put in fluoride varnish or dental sealants, or an audience like special healthcare needs or pregnant women. So I think that if you experiment with our library, you'll be happy to see how much is cataloged, and almost everything nowadays has the link to the document. So it's a nice reference to be able to find even more than what we've done. To see the publications that are just from us, you can use the publications tab there, and we just helpfully catalog them by category and by date. So on the category page, you'll see first we start with resources for consumers, so it's another place to find those things I showed you earlier. Or you can click resources for professionals and jump further down the page, and we have all of our things itemized by category. And then of course on the by date page, we have them all strung out by date. Our Resource Center has been in existence for about 20 years now, so we have quite an archive of publications, and it's a nice way to browse the different types of things that we've done. This next section is the topics heading on the left navigation bar. And underneath, there are all sorts of different topics in case maybe you're not an oral health professional, or maybe there's an aspect that's new to your work and you'd like to just get a basic overview of what's available on a different topic. So let's take a look at one of them. I thought maybe fluoride varnish would be relevant. Each topics page starts with this list of key facts. And the idea here is that these are cited facts from the professional literature, and the references follow just below what's shown here on this page. So you can pick these up if you're writing a background on an oral health issue, or perhaps you're writing an advocacy letter and you need to have some facts and figures to back up your writing. You can use these, maybe even reword them a bit for social media campaigns, but the idea is we're giving you trusted information from the literature that you can use with confidence. So we show key facts and then the references, and those are all linked as well, so you can read the original text. And then the next section is where we show you anything that we've produced about this topic, so that's under OHRC publications. And then we pull out a sampling of what's in our library on the topic, and we end with information like our phone number and email address in case you just didn't find what you were looking for on this page and you'd like a little help looking in the library. So I encourage you to browse the topics, and also if there's a topic that you need to learn about and you don't see it there, we'd like to hear from you. If it's an emerging issue or maybe something that is relevant legislatively in your state, something that you have a resource to offer on a topic and it's not there, we'd love to hear from you on anything that's missing here. We produce new ones all the time. This next section is where we talk about those MCHB funded oral health projects. So the current funding cycle right now is the perinatal and infant oral health quality improvement grants. And that is wrapping up this summer, and then that new grant opportunity will be in competition this spring to start next fall. And the other two items under this category are past project categories that have wrapped up. So that's where we put tools and information for those grantees and for those who are interested in them. I see a topic pop up on the chat box about silver diamine fluoride, and you read our minds. We are in production for a topic on silver diamine fluoride right now. We do have some things in our library, so you can search that keyword, excuse me, in our library and look for a topic on that soon. The next section on the left nav bar is about the Title V MCH block grant and the National Performance Measurement System that was implemented recently. So that's a whole way to learn about that sector of things if you're interested in that. This next item, childcare and Head Start, I wanted to spend a little bit more time on because I think this is another area that could be very useful to you. As I said, we have another project funded by the Office of Head Start that goes through the American Academy of Pediatrics for this National Center on Early Childhood Health and Wellness. We are the Oral Health Subaward for that project, and we cross-list the materials that we do for that project on our website as well as the Federal Office on Head Start website. So I wanted to take a look at these. There are a couple of different items that might be very useful to you and your community and your colleagues. One is that first item there, that Brush Up on Oral Health. That's a monthly newsletter that comes in the email and is also available as a PDF. That's a super topic-focused 3-pager about kids and oral health and Head Start and early Head Start, but also childcare, and really relevant to any of the 0 to 5 population. It's great for parents. It's great for childcare providers. It comes with a little recipe at the end, so it's kind of seasonal. And you can subscribe to that and get it in your email, or you can just visit that link and go see the content every month. There are many, many back issues available in Spanish as well, and going forward, it's going to be available in Spanish at the same time as the English version. So that's a really nice way to just subscribe for some great oral health information. A lot of people receive that email in their inbox and then send it out to their network of program providers. Then another thing there is that Healthy Habits for Happy Smiles, that series that I told you about earlier. So that's just a cross-link to that. Scrolling down this page, you can see that there are resources from us about Head Start and then selected websites. And in the circle under the Office of Head Start, if you follow that link to oral health, it goes to the Office of Head Start website about oral health in that national center. So now I'm leaving our website and going to this other website. But I'm doing that because I think this is a fabulous source of great information that is in the public domain, and you can make copies of this stuff too. So I think a lot of you maybe noticed this video about toothbrushing at the table that was announced this fall, and really glad to hear that some of you are using that and finding it useful. Scrolling down this page, there's much, much more. All of those blue boxes go to pages with just lists of great information on all these different topics, like oral health resources for staff, for families, about assessment, follow-up, and treatment. And then these other graphic boxes here link to different resources that you can access as well. This Cook's Corner on the lower left is a compilation of the recipes from that monthly Brush Up newsletter into one big cookbook. It's really cute, fun family recipes or child care center Head Start recipes. And almost everything here is in English and Spanish. And it's all in the public domain. So I just wanted to encourage you to visit that website as well as ours when it comes to materials for families. Okay, coming back to our website, the next 2 items are just sort of on the left navigation bar, or just in case you're interested. The news item is where we put an archive of announcements and a list of all of our email lists in case you'd like to subscribe. And the organizations tab is kind of funny. It's sort of a holdover from before Google took over everything and helped us find anything. This is sort of an old school list of the different players in the organizations about oral health. So if you're wondering which federal agencies have an interest in oral health, or what are the relevant foundations, you can use those curated lists. Okay, so we're back at the homepage. There's one other section I just wanted to tell you about, and it's at the top, the About Us and the A to Z. The A to Z is just a site index, but it's kind of handy in case you don't want to remember how we have organized things. You can just look alphabetically. And of course, the About page has our contact information, a staff directory, and information about our funding and different projects. If you scroll down this page, you'll get to a part about copywriting permissions. In case what we talked about earlier, you'd like to double check that. This outlines how we allow photocopying, but if you adapt or reproduce, we'd like you to request permission. And we've even linked up a sample letter, or you can just send us an email and we'll start the dialogue from there. So that's a really nice place to just go and check in case you have any questions after this presentation. Okay, so here's my contact information and my email address. I really do welcome any messages, and that's my director. Katrina Holt is the director of OHRC, and that's her email address. And you can write to our general info address as well. And we're on Twitter, and you can sign up to receive our monthly e-newsletter that's called OHRC Update. That's different than that Brush Up one. The Brush Up one is for families and program staff, and this is just about anything new from us or news in the oral health, public oral health community. So I think that Katie has a link queued up to share this sign up link with you and in the evaluation, but we'd love to have you in our subscription list. So that's the end of my slideshow, but I wanted to preserve some time to take your questions, and we can look on the live website a little bit. Katie shared with me some of the things that you guys have been talking about, or that she's asked you what you're interested in, and I queued up a couple of websites to share with you. Katie, are you seeing a different website now?
I am. I'm seeing the Mighty Mouth. And before we transition to the website, we do have a question in the chat box.
Great. Let's see here. Targeting MCH. We do not have a lot for seniors, which is unfortunate. I mean, through the definition of maternal and child health, we can kind of sneak into dealing with fathers and women of childbearing age, but we're really not funded to address information about senior oral health, and that's because the feds have a pretty strong feeling that they shouldn't fund anything in duplicate. So we need to kind of stay in our lane and not do that. So I'm sorry that I don't have a lot about seniors. Keep those questions coming. But in the meantime, I'll just address some of the things that Katie tipped me off about earlier. She was mentioning maybe any radio campaigns, public awareness campaigns, or social media campaigns. And I have two great recommendations, and these are from our library, and a great example of the kind of thing you can find in our library when you search. So the Mighty Mouth, maybe you know about this. This is from Washington. What used to be the Washington Dental Service Foundation is now Arcora, I believe. Am I saying that right? Now I'm going to make you dizzy again. Arcora. So the Mighty Mouth has a bunch of great things. Here's a video about the first dental visit. At the bottom here, if you click on any of these resources, you're going to find great stuff. But here's the part I want you to see. On these resources pages, if you click on spread the word, you get all these Facebook messages and tweets about oral health. So I think this is a terrific source to find things that you can share in social media about oral health.
Yeah, and Sarah, we're seeing the Mighty Mouth screen, but we're not seeing the Twitter, the social media part of it. We're seeing their homepage. Is there another page that we should be seeing?
Oh, yeah, I bet, I moved my window and I bet it stopped the share. Let me try again. Thank you for piping up.
Yeah, and these are really great resources because a lot of local health jurisdictions are preparing for next month for children's dental health.
Right, good point. Yeah.
And
okay.
a lot are running ad campaigns for the first time, and they're looking to see if there's any scripting out there that they can.
Great. Yeah. And of course, the American Dental Association, that's their flagship activity for outreach during the year. So they have a lot of great stuff too. Also PBS and Sesame Street are good sources for promotional materials. Let me back up. Can you see Mighty Mouth now, Katie?
Yeah, we can see that. Thank you.
Great. So before I was on this homepage and I just said, scroll down to the bottom, and here's that video I was talking about. And then if you click on any of these resource topics here, like Mighty Tooth Minutes, Mighty Mouth, I keep saying Mighty Tooth, Mighty Mouth Minutes, then you can look at the Mighty Mouth Minutes, but you can also click on Spread the Word, and that's where you find the Facebook posts and the tweets. So that's, I think, a really nice resource. The another great thing, if you're interested in how these are developed, Mighty Mouth actually had a great presentation at the National Oral Health Conference in 2016, and their presentation is online, and they go through everything about how they figured out what to say and that found their target audience. It's a terrific presentation that's kind of fun to spin through. Similarly, there's another site from Maryland called Healthy Teeth, Healthy Kids, and this is from the Maryland Department of Health. And again, has a ton of great information on outreach campaigns. It's available in English and in Spanish. I think it's really well done, and it has a lot of great information in different formats. The other thing about that is they also have a behind the curtain guide about how they launched their campaign. And this is a really long document, but if you're looking to learn more about how to develop a campaign and pull together partners and messages, this is a really nice guide, and you can see it's very comprehensive. So those are my top hits for public awareness campaigns and social media. Oh, I see something in the chats about the Administration for Community Living. Oh, for seniors. Okay, so Margaret, you were asking about oral health information for seniors, and Dr. Kumar has contributed that chat about a guide for oral health programs for seniors from the Administration for Community Living. Another thing that Katie mentioned to me was community health improvement plans, action plans, and needs assessment. And frankly, I just searched in our library. Our resource center hasn't developed tools specifically about that, but I've found some excellent resources, and I'll wrap these up in a collection of links to share with Katie so that you can have access to these sites in the future. But this one is from the Center for Healthcare Strategies, and it's about social determinants of oral health, but it does have a section, and I'm going to scroll now, so hold your breath, about the needs assessment. So this might be nice because it's got examples from local communities as well. And of course, there's the community guide, which is foundational. They have a page on oral health and about tools, and that has some information about needs assessment as well. There's an adult oral health community guide on program and implementation with a really robust needs assessment section that could be adapted for whichever population you're working with. And the American Association for Community Dental Programs published a community guide that's, frankly, this guide for developing and enhancing oral health programs, community oral health programs. It's just a little bit dated, but the foundation of the content is sound, and the section here, step 2 on assessing needs and resources, is pretty robust. So even though it does reference Healthy People 2010, I think the cookbook nature of the needs assessment is strong. And then my final one on that is the the Association of State and Territorial Dental Directors, ASTDD. Part of their 7-step model is a needs assessment. Of course, that's more at the state level, but I'm sure that it could be, you could get a lot out of that considering a community needs assessment. What else do you have in mind, or what else would you like to see more of?
Yeah. Thank you, Sarah, so much. This is a wonderful display of resources that have been created and can be a great use to the local health jurisdictions.
Terrific.
Yeah. Does anyone have questions? If you do, please use the chat box. Anything at this time? All right.
Well, let me just click over. Let's see. I think I just need to refresh this and just let you know that this is that part that has been updated of the new funding opportunity announcement. And this new opportunity, I just had half an hour to read it before we got online together. It's very different than funding projects that I've seen for oral health in the past. It talks about a network that will be funded in, I think they're going to fund 3 networks one from different sectors of the country. So I really encourage you guys to take a look at that to see if you wouldn't necessarily be the entity that is applying and is awarded, but you might have opportunities to work with that network and be included. They're looking for the network itself to build partnerships with safety net service sites. So I think this is an interesting development in the funding story, and would likely be of interest to many. And I see in the chat box somebody's asking for a list of all these additional things, and I will be happy to produce that in an email to go along to Katie that she can share with you all, along with the PDF of the presentation and the recording.
Great. Well, thank you so much, Sarah. It's great to see all these trusted resources that we can translate at the local level. Just thank you for putting this together and sharing it with
Sure thing.
Throughout California, and then with the new funding that's coming up as an opportunity. It's just a reminder, if you guys can join the listserv for the Oral Health Resource Center, so you guys do get these notifications right away, and that will be part of the evaluation that will be coming out following this call.
Well, thank you very much for all of your time.
Great. Again, thank you for your time, your expertise, your passion for sharing resources. And if anyone has questions, please reach out to Sarah on this. And you can also reach out to us here at the Technical Assistance Center. We're happy to help you in any way that you can. And we know that oral health promotional materials has been an ask from you. So we're happy to present this webinar. We hope you found it helpful and beneficial, and you can share it with your teams. And as Sarah mentioned, that she will be sharing the link to these resources, and we'll be getting that out to you very soon. All right. Thank you, everyone. Have a great day, and we're going to go ahead and close the webinar.
Bye-bye.
Thank you, Sarah. Thank you, everyone.